closed captions.
We're live.
All right, we're back. It is 10:12 on April 28th, and we're going to go through, we're picking up on S120 where we left off. And now that we have Ledge Counsel with us, we are going to go through the language and see what changes have been made or the improvements that have been made.
Great. I will, Nellie, can you let me share my screen? I will put up the language. Thank you. All right. Jennifer Carby, Legislative Counsel. This is S120, and we're looking now at draft 3.1, which I believe is posted, and specifically at the PBM and 340B language. So I've done a markup showing the changes from the earlier versions that we looked at. This is still adding some language in Title 18 and an existing section on pharmacy benefit managers, PBMs, and their required practices with respect to pharmacies. In this new subsection D, it would say that a pharmacy benefit manager shall not, and then we took out this sort of broader language and stuck with the two narrower provisions. So shall not require a claim for a drug to include a modifier to indicate that the drug is a 340B drug unless the claim is for payment directly or indirectly by Medicaid, or restrict access to a pharmacy network or adjust reimbursement rates based on a pharmacy's participation in a 340B contract pharmacy arrangement. It would prospectively repeal that on January 1st, 2023, which keeps it in effect through the end of 2022. And at midnight, as it turns to 2023, that's when the repeal would occur. So obviously you can change this date. I think the way the language had been provided to you was that it would take effect immediately and would expire on this date unless, or on December 31st, 2022, unless it was extended. So this does the same thing because the legislature retains that ability to modify or extend the date, but it sets it up to happen. And then it has DFR and the Office of Attorney General. So on or before January 15th, 2022, DFR, in consultation with the Office of the Attorney General, would report to this committee, House Healthcare, and to the Finance Committee regarding national activity affecting participation in the 340B drug pricing program, including recent changes to the manner in which prescription drug manufacturers pay rebates to pharmacy benefit managers for prescriptions filed through 340B pharmacies, the potential impacts of these changes on Vermont stakeholders, including individual Vermonters, and possible state responses to prescription drug manufacturer and pharmacy benefit manager actions related to participation in the 340B drug pricing program. And then finally, in the effective date section, I struck out the language saying that the PBM 340B provision would take effect July 1st, and instead just says it takes effect on passage. So everything would take effect on passage.
Okay, thank you. And we do have this on our webpage, and the changes do begin on page 7. So we're all set. We probably can take that down unless committee questions on the language for Jen. Okay. There you go. That's good. All right. Committee discussion. Jen, really, thank you so much for working with folks on this. And it really does offer clarity. It is extremely helpful. And we know what we said before you got here was that these types of things come up at the last minute frequently. And fortunately, we were able to make some changes that accommodate the request. Hasn't been easy, it never is. But I think it is important going forward. So thank you for being with us on this one. It's good. Okay. Any other questions? Discussion committee? Any other questions overall on S120 discussion? I have one item. It was brought to my attention by Diva. And Diva was asking if the primary care study could, the one that asks how much will it cost to, what are the costs associated with 2 primary care visits for everyone without copays? The suggestion was to put that into the benchmark study with DFR. Unfortunately, the bill had already been through the budget process and was taken out of the bill that we have before us. And then I heard from the Green Mountain Care Board that it might cost some money to do the study that we have in there. So that's hanging out there. My suggestion to Diva was to please take this suggestion to the House and perhaps to the Appropriations Committee as they negotiate the budget. So it's not something that we can deal with right now. It's unfortunate. That one came too late for us to consider, but probably a good suggestion. So, at least in my mind. So that one, I'm just letting you know that that's out there, and Senator Hooker, you're on the hook for that one in some way because you're reporting the bill, but go ahead.
Yeah, right. So it's still included in this bill.
No,
The primary-
the
Primary care.
primary
Yeah.
care is in the bill. Absolutely. It's in the bill.
Right.
It is in the bill. The request from Diva was to include the
with
primary
DFR.
care analysis in the benchmark plan.
Mhm.
That's Senator Cummings.
Yesterday, we had some talk about the administrative cost study and what it was going to include, like the cost of complying with or taking part in our,
Healthcare reform.
healthcare reform, the bill back
Oh,
from
right.
Green Mountain Care,
Yep.
just to make sure that it's not it's gone up 20%, but it's gone up 20% because, have we covered that?
There are no changes. I have not made any changes to the report requirement. So right now it still says just an analysis of the increase in administrative expenses with the increases in the CPI. It doesn't
And
break anything
now,
out.
I think analysis might imply the type of information, but would you like to
I think
see?
it might be helpful to say including but not limited to cost of participation with, the healthcare reform efforts,
Okay.
costs that have been shifted from the general fund. We've done
So
that.
Would it be helpful, Senator Cummings, to have in this information that gets provided? I mean, right now the language is having the Green Mountain Care Board provide an analysis just of those increases. Do you want them to break out sort of which ones or what the increases are, both including and then excluding the bill back, the premium processing?
I mean,
and
I think
the
when people
healthcare reform?
hear, administrative costs, the first assumption is, oh, everybody got a raise,
Yes.
or a lot of raises. And I think we need to make clear that there are other factors involved in the increase in that cost. Now, how we do that, I don't know. We could look to some.
I mean, I think we can have the board present the information. I think we can put language in that directs them to maybe to break out either the different categories, or exclude these types of expenses, so they could give you an overall administrative costs and then administrative costs excluding these categories or the
I
increases
don't know if
in
we
each of
know
those
all of them,
categories.
but broken out by category, cost drivers by category.
That's good. How's that?
I think that works. So just to say, the board shall I'm just trying to think of how to say it.
The analysis shall include or will have
Explain.
something
yeah,
like, I don't know how to,
shall.
categories of expenses related to increases over time, something like that.
I think Senator Cummings' language about cost drivers is appropriate, and they should know what that means. That's a term that's used for what is making the administrative costs increase. And
Yep, that works.
Okay, so
Nolan is here.
Yeah, you could, instead of being specific, you could say including causes, drivers, and other. Without
Well, I
being
just added a
specific.
second sentence that says the analysis shall break out the administrative cost drivers by category. Does that get at what
Yeah.
you're
Yeah.
looking for?
That's great.
Done.
Good reminder, Senator Cummings. Thank you.
Okay, good, thank you.
Do you want to show it to us, Jen, briefly after you get it?
Sure.
Okay.
Yes, I was just updating the
No.
draft number.
Okay.
So yes, let me put it up.
What does that make it? 3.2?
3.2, because I'm gonna have to take out the highlighting and stuff anyway.
Yeah.
So this is the new sentence here. Oops. So we have the analysis shall break out.
Do you want to take out the word "the" before administrative cost drivers and just have it be administrative cost drivers by category? "The" always implies that there's kind of a definitive number, and I don't know whether that's possible. Could go into micro categories.
And we'll add maybe we'll add insurers.
Yep.
In here so it's clear they don't have to compare the cost drivers and the CPI.
Yes. Okay.
I wonder if it should say, shall break out administrative costs and cost drivers, because you have your costs, which are fixed. And I think of cost drivers as things that are constantly pressures.
How's that?
How's that work with our financial wizards? Is that good? Senator
Where-
Cummings, does that work for you? Where is she?
Yes,
It's so hard when we can't see each other. Ruth, you're all good with that?
I would just say the analysis shall break out insurers' administrative cost drivers by category.
Okay, so Nolan,
That's what I had.
yeah, that's
Oh.
what you had. So then Nolan suggested to put in administrative costs because there are some fixed costs.
I think it's just redundant, but I
All right.
don't have strong
Wait.
feelings about it. So, either way is fine with me.
Let's leave the Department of Redundancy in for now. and
Okay.
then, still has a ways to go. Okay.
Should we also, in the area of redundancy, Senator Hardy will love this, but the analysis shall identify and break out? Just
Again, I
'cause-
think that's redundant.
That's why I said
That's
you, I
really
thought you'd love it.
redundant. That,
Well,
that
you know-
one's, that
well, you
one's
know-
really redundant.
Jen gets paid by the word. I'm just trying to help her.
Oh.
No, I don't.
Ken and Dickens.
We go for conciseness.
I think honestly, I do think that the folks filling it out will know exactly what we're looking for. And I think you're right. We don't need to be.
Right, and this might be, yep, okay, this is good. Are we good with that then?
Sorry,
Anybody
Ken,
on the committee not good with it? All right, let's, so Jen, does that make it then 3.2?
Yes, and I also will, let me stop sharing.
Yeah,
Um, and I will take out the highlighting and the, clean up the PBM stuff.
Okay. Okay. Any further discussion? Anything else? All right. Now I would accept a motion on draft 3.2 of S120. Senator Hooker,
I move that we accept draft 3.2 of S120 pending cleanup.
what, yeah,
The cleanup has been completed.
the
Okay.
cleanup is completed.
Wasn't much.
Can you send that to Nellie so it's on our webpage? That'd be good. And that'll be
Yep.
the final draft for the reporter. So are you suggesting that you'd like to pass this to the full Senate?
Absolutely.
Okay. Committee discussion, questions? Senator Terenzini,
Yes. Thank you, Senator Lyons. I'll call the roll for S120 draft 3.2. Starting with myself, I'm a yes. Senator Hooker,
Yes.
Senator Cummings,
yes,
Senator Hardy,
Yes.
Senator Lyons.
yes,
I have a vote of 5-0-0.
perfect. And Senator Hooker, you are the reporter.
Yes, ma'am.
Okay, and this bill, so in discussions, various discussions, discussion number one, the bill will go to rules. And then I understand that there is some interest on the part of rules. We're hoping to move the bill out favorably to the full Senate. So that, Senator Hooker, you may be invited into rules.
I'm on that
It'll-
committee.
Huh?
I'm
you're
on
on
that
it.
committee.
Yeah, okay, good. All right. And so it's either you or me, but you're perfectly capable. So then the other issue on this bill is that in talking with my Senate peer about the bill in the committee of jurisdiction in the House, rather, there was huge concern expressed about the lateness of the bill. So we're continuing a dialogue, and I understand that there will be a dialogue going on in the other places as well. So just to let you know, this will be a heavy lift for House members. Imagine our getting a bill right now but it's not like they haven't known about it, because I've been in conversation with Representative Lippert now for a long time about the bill. So that's it for that one. Good work. Thank you. Thank you, Nolan. Thank you, Jen. Committee. Thank you, folks who are still with us, Helen and Devin. Thank you for your work on that section. Greatly appreciate it. It's good. Okay. Anything else, committee? Because I think we're really, I don't have anything else on the agenda for us today. As I said, keep your eyes open for Friday. We may have an update from DCF on residential children's residential care facilities. So thanks, Jen. Okay, so we're good. Excellent. Now you have some time to get ready for the floor. I know that there are a lot of bills of ours coming up and everyone